Well, welcome back, everyone. Today we're talking about brain surgery, what it is, when it's needed, and the remarkable neurosurgical care that's available right here in our community. So joining us is Dr. Jeffrey Lobel. He's a neurosurgeon and medical director of neurosurgery at Lima Memorial. So Dr. Lobel, thank you so much for being with us.
Thanks for having me.
Yeah, so to start, can you give us a general overview, like what types of conditions might require brain surgery?
That's a wonderful question and a complex one to answer because there's so many different etiologies that require brain surgery. Anything from a trauma to a standard tumor that's been growing gradually to even conditions where people have movement disorders or even sleep disorders. So it truly depends on what the individual presents with and what we actually see, whether it's an MRI of the brain. Sometimes I do spinal cord surgery, and that would include MRIs of the spine. And it depends on what the patient hopes to accomplish.
Right. So, brain surgery sounds intimidating, I would say, for many patients. So what kind of advancements have made these procedures safer and more precise today?
You're exactly right. Brain surgery is quite intimidating because it's our brain. And the advancements have actually occurred over many years. And neurosurgery in particular has a long and very storied history. Anything that you see on TV, it may be exaggerated to some capacity, but the true advancements that we've had are basic surgical techniques, microsurgical techniques, microscopes that we use, and even navigation and various chemicals we use to enhance the actual margins of tumors and areas that we're interested in operating on. There are more minimally invasive brain surgeries, sometimes for aneurysms and sometimes for movement disorders in the form of brain stimulation.
Yeah, so you bring an incredible level of expertise to Lima Memorial. So what does it actually mean for patients to have access to this level of neurosurgical care that's just close to home?
Well, it's very nice that we have the ability to do a lot of complex cases at Lima Memorial Hospital. We've improved upon technology. Our nursing staff is wonderful. Our facilities are very, very good. And our outcomes have been very good in addition. So to have this level of access is very important for our community because oftentimes people who unexpectedly require brain surgery cannot travel, or their families don't want to travel far away because it may require recovery and a lot of family support. At our hospital, we've been able to increase what we do because of various technologies we've purchased, along with technologies we're looking into for the future to improve our outcomes.
Yeah, so can you walk us through what a patient can expect from, let's say, diagnosis to recovery if they need brain surgery?
It is a difficult question to answer sometimes because it depends on what the pathology or what the problem is. A trauma frequently is something that's very unexpected. We have a trauma team that would work up and evaluate an individual. And if they require emergency surgery, frequently we'll provide it depending on whether or not it's necessary. For more elective surgeries for brain metastases or brain cancers, oftentimes I will see the patient in the office. We will discuss what's required. We will discuss how the surgery is performed and also the expectations of what surgery is. After all, it is brain surgery. We're opening somebody's head up to remove something. It is quite intimidating, but after a good conversation and an opportunity to answer questions, frequently people are quite relaxed and very surprised about their experience.
All right, so finally, doctor, for someone that's watching who may be nervous or has questions about your services, how can they contact you?
They can contact us directly in the office. My hope is they don't need to come through the emergency room because they've gotten so sick, but they can reach us through the neurosurgical office here at Lima Memorial Hospital.
All right, fantastic. Well, doctor, I appreciate you coming on today.
Thank you very, very much.
Yes, so don't go away. We have more when we return.